Welcome to everyone to yet another exciting episode of Connections. Thank you so much for joining us again this evening. So how are you today, Lekano?
I am feeling so good. I'm very excited for this topic. And wait, I want to share with you guys, today for the first time ever, I stepped inside a gym.
That is sad. After how many years?
After 19 years of my life. But I don't think I'm going back. No.
Oh, no, why?
No.
Yeah.
No. No.
It's good for you.
It's good for you, yes. Promote being physically healthy, but I am not going back to gym. I'm sorry, I had a hard day.
Shame, right?
But I'm very excited for today's topic. And Mr. Luto, how are you?
I'm very well, thanks. I'm just as excited for today's topic. Rather excited and, you know, as awkward it may be. You know, it's very informative that, you know, I've got to point out. To start off, a warm welcome to you folk at home. Glad that you could join us. It's going to be a great show. But before we can even reveal what it is, I'd rather give you the step to inform the viewers at home what tonight's topic is all about.
Clipboard, that's what she is.
Okay,
Miss Clipboard, hence the clipboard,
I must do it. Okay, fine. So today, as you guys know, it's Wellness Wednesday. So we're talking about teenage sexual health. A bit of an awkward topic, but I think tonight we're going to be quite positive about it and clear the air about a few things.
And I think, you know, it's okay to be embarrassed about talking about sexual health. I know I'm one of those people, like, I'll be in the corner giggling like,
look at her right now. She's already blushing.
So yes, you heard us. We are talking about sexual health. So make sure that you send in your questions. Don't be shy. We want to get talking to you guys. I am extremely excited, and we are going to learn. That is what we are going to do today. Look, we are not promoting any frisky behavior. We're just educating.
Responsible.
Responsible. Be responsible. And we're just here to learn and educate.
As awkward as the topic is, we've got to face reality that most of teenagers, in fact, in our country you know, they are sexually active, and it's a problem that we're facing because they're not as educated, and therefore they, you know, they get all these diseases and everything, and they fall into these traps. They're lured by traps. They're lured into these traps by people their age and peer pressures and many other things that we're going to be focusing on tonight as well, not just shooting all those eggs at one go.
Whoa, Luto, leave something for the guest to say when she comes on later on after the break.
Of course, she's
got to have something to talk about.
I'm excited for her. She's so gorgeous.
She's great.
She's so
we
fun.
had a chat with her
I'm
earlier.
excited.
She's a great person.
But before we get to that, let's define what sexual health actually means, so you know exactly what we're talking about. Sexual health is a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence.
Yes.
Great definition.
Before we all get, you know, scared by that definition, don't worry guys, don't panic. We are going to like dissect it for you. We've got an expert in studio, so she's going to help us just break it down piece by piece. We're gonna tell you what that is all about.
Hang on 2 seconds. It's like we're talking about like the proverbial she, like she's the queen. Her name is Amri.
I'm sorry.
And she's a sexual health educator.
Yeah, that's what she is. That's what she goes by.
But she'll correct me if I'm wrong.
Well, quickly, guys, let me tell you how you can connect with us. It is very simple. Well, a very good person told me that I say the numbers too quickly, so I took that constructive criticism. You know, as a person, you must take it and deal with it. So I'm going to tell you the numbers very slowly. You can call us on 083. You can SMS us on 083 44 888 10. It is 083 44 and then you can give us a ring. Our number is 086 105 8262. And then of course you've got our Facebook, www.facebook.com/mindset connections, email connections@mindset.co.za, and of course Twitter. Whoop whoop. Tweet us guys. It is @connections319.
We're hard to miss. We're everywhere.
That's why I always say you can't give us an excuse and say, I don't have airtime. If you don't have airtime, you can always send us an email. That doesn't
yes.
And a big thank you goes out to PC Training and Business College for they have sponsored us with this tablet. So thank you.
It's great. Yeah, without that tablet, we would, struggle getting the emails.
Everything
Twitter,
goes through this. And I must mention, we have a question actually on Facebook from Tabiseng, and she says, she asked, what are the signs of STI? Tabiseng Millicent. So we will answer that question when the expert is in studio, Miss Avery.
Yes, for sure.
We don't want to mislead anyone.
Because I can't diagnose.
We'd rather leave those for the experts and those who are qualified in such a profession.
Definitely.
For sure. Yeah, so what's your understanding of sexual health? Like,
to me,
what do you think it is?
To me, I look at it as, like the physical part of it, the health part of it, hence the sexual health, what to avoid, when to avoid it. And it is really important that you know what the consequences are if one is already, active and is all out there. And that's basically
the choice to become active.
Yes, and basically, because you'll be going through a stage, teenagers, you'll be going through a stage, and your bodies are running wild, hormones levels up and down, and everything. And then your mind may not be reasoning the same as the chemical imbalances that are going on in your body. So it's also...
Oh, Professor Lutogado, yes.
Not yet.
Yes.
So it's very important that you sort of think mental-wise as to what am I engaging myself into, what are the consequences into it, and respect yourself and respect others.
Yeah, for sure. Thank you. I think that's really important, though, that kind of thing about respect, because you need to highlight it has to be about responsibility and respect for others and respect for yourself at the end of the day, because you can't force someone to do something they don't want to do, and you shouldn't feel like you're being pressured into doing something that you don't necessarily feel like you're ready for or you don't want to do. I think it's important that people take a stand for themselves and know who they are and respect who they are enough and respect another human being enough to kind of be like, okay, these are my boundaries. This is what I'm talking about, and not having any dodgy, weird snacks things out there. But if you love to do it, smack you in the face to say that.
And you remember, just as I said a few weeks ago as well, I think the first week of our show nights, that as diverse as our country is, many factors determine how one behaves. Just the background, your where you come from, background falls a huge part of it. Religion, family, all those things play a huge part of one. And you just need to. Many may not, respect one's decision or whatever it is, but we need to be aware of multiple factors of what what lies out there.
So last week, guys, we actually talked about hormonal changes, puberty, when we were discussing body image. So now all of a sudden, one day you're just normal, and then the next morning there's this hormonal imbalance. Your body is in
a guy that you're like throwing Play-Doh at. It's kind of like
acne all over.
Hello.
Everything. Your body is fighting with itself. I promise you. And then you get these feelings. How do you deal with those? Like, one day you're normal, then the next day you've got sexual feelings. Like, what is it, and how do you deal with it?
Okay, well, I think before we get there, let's leave that again for the royal.
You don't want to mislead anyone.
The royal she of this book. But before we get there, into how you can sort of have a healthy sexuality, I think let's start at the beginning, because that's the best place to start.
Yeah, the beginning.
Let's talk about virginity and the dreaded word masturbation. Masturbation.
Got that in your system.
It's not like if you say it over and over and over and over again, like the word sort of starts to lose its stigma, and you feel a bit better about it, and then you can say it because it's just a word. You see?
Masturbation.
There's a message to my madness, Luto.
Okay. I see your biological
masturbation.
Yeah. So Luto, what do you think about that, Luto? What do you think about about how we sort of perceive things like virginity and masturbation?
I do not know. It's basically how one feels about whatever it is. I mean, I had a chat with the expert earlier, but I don't want to shoot all her eggs at one go. But it's, no, as in points. Take it, points.
All right, okay.
She'll elaborate on it further, but I mean, I was misinformed on this as well. But it's basically one's desire, I suppose, that, you know, it's their choice, I suppose. Yeah. You know,
but don't you think that, sorry for interrupting, don't you think that society and media kind of play a role in when people start to think that things should be happening in their lives, where and how people relate to virginity and masturbation and sexuality in general? Don't you think that the media, like movies and TV series and adverts and whatnot, kind of shape your perception about your sexuality before you've probably even begun engaging in one?
You know, the thing is, though, have you noticed how with us girls, your virginity is so precious, and with guys it's like I want to lose it now. The quicker I lose it, the better I am in life.
And I think in my opinion, that kind of stems from a place where virginity is tied to property and wealth. Even like when your father walks you down the aisle, that's a continuation of that cultural indoctrination and gives you away. Even like you're being deflowered, like someone's taking something of value from you. It's a social construct that's been going on for centuries, honestly. Like,
and also,
it's like forever. Like forever and ever, the subjugation of the female, of the fairer sex.
Look, just as our producer said earlier, you know, in African cultures, she's black, she's Xhosa, in African cultures, when one is, you know, when a guy's going to pay lobola and everything, you know, if a lady is still a virgin till the time she decides to get married, the lobola price is apparently, you know,
higher.
It goes up, but I think that stems directly from like centuries of patriarchal
centuries, as I say.
Nonsense.
And just
nonsense.
One views it as nonsense, and others we take it as a cultural thing. Like
for sure, I understand that people can have their culture, even if it's daft.
You crazy.
I'm joking. It's not daft. It's not daft. It's important. It's a cultural practice. We should maintain these things. But you know, we're not
masturbation quickly. What is your take on it?
It's healthy.
You?
I said my point. My point will be covered by the expert.
No, we want to hear your
opinion.
I said earlier, I do not. Yes, this is your rather. You know, you big up this topic. I don't know.
So you have no take on masturbation.
You are lying.
The expert will
you are
cover
lying
that for me.
right now.
I know, guys. It's embarrassing. And I must say, it's embarrassing. I'm totally one of those. I said before, this is a kind of like a nail biting.
No, I just thought that I covered what I said earlier well.
Don't worry, I'm here.
And if you're not, don't worry. We're together.
Yeah, we're all together. Yeah, this is a positive space to speak about these things. This is exactly what we're trying to do. Well, before we cover all the topics, before our expert can come into the room, let's go to an ad break. And please don't leave us. We've got so much information for you after the break. Welcome back, guys.
Yes.
Welcome back to another fantastic episode of Connections. We've got our lovely guest, Avery Spilker, with us today, and she's an expert on human sexuality, right?
Yes, I'm a human sexuality educator.
Educator, yes. Well, I like to call you an expert because you're the royal she. Anyway, we're back from our first from ad break, and we're going to be talking to her a lot more about sexual health. But we're going to be focusing on the ladies at this point, and then move on to the gentlemen a bit later. So, Dekano, do we have anything on social media?
Well, we've got Apiwe Magatini, who is a very big fan of the show. So thank you very much, Apiwe. And he says this topic is closely linked to puberty, and as much as we hate to talk about it, we all went through it some stage, which is so true.
Very true.
Very
thank
true,
you so
actually.
much for your thoughts.
Yeah.
Apiwe.
Yes, that is Apiwe.
Yes, thank you again, Apiwe. So, Avery, tell me, sexual health. Tell us, everyone.
Right, okay.
What does that mean?
Okay, well, first of all, I just need to disclaimer by saying that I'm an educator, so I'm not a medical doctor and I can't advise about medical issues. But we will be giving a link on Facebook where you can look up information about all the STIs and all the treatments and symptoms of those STIs. Okay, so human sexuality, the best way that you can think about it is as an intelligence that you have to actively develop all the way through your life. You need to think of it as a global thing.
Okay.
It has a physical side, your body. It has a psychological side, so your mind and what's happening in your heart. And it also has a social side. So what's happening in your environment with your peers and your school and your parents, you know, that type of in your community.
Okay, cool. All right. Thank you. And then from a biological sort of angle, what can one expect in terms of their sexual health when they're kind of developing and growing up and figuring that out for themselves?
You know, girls, you have to remember everything that you go through on a daily basis. You know, think from the bottom up as you're going to the bathroom. Okay, so let's get real here. Okay, so deep breath, especially you.
She's sitting there like with bated breath.
Let's start this off like from the bottom. Okay, let's say vagina. Come on, these are the words. All together, come on. 1, 2, 3,
vagina.
Okay.
She didn't say it. Giggling her
Vagina.
Well done.
Okay,
Congratulations.
this is the way that we get rid of the awkwardness around sexuality. Is we take the words and we include them into our vocabulary. Right, so when we go to the bathroom and we have a wee, we wipe from front to back. Because that makes sure that any of the bacteria does not go into the vagina. Because the vagina is a very careful ecosystem. It's like a swimming pool. It has a particular pH. And if that pH gets disturbed, then you get infections. So whether you are sexually active or not, you can get infections. And if you, for instance, start feeling an itch, or if your discharge changes, which if you've spoken about puberty, after you hit puberty, then you get a discharge, which is generally odorless or milky in color, and it shouldn't smell, but if it does smell, or if you go to the doctor, it can be treated very easily. It might be due to a yeast infection or something like bacterial vaginosis. Very easily treated.
Okay, cool.
Yes. So other things that you need to consider as a girl are things like your feminine hygiene products. So what do you do over your periods? So are you going to choose tampons, or are you going to choose a pad, or are you going to choose the cup? Okay. So the important thing to remember about pads and tampons is don't throw them down the toilet. Okay, it's bad for the environment.
Yeah.
Okay.
I can imagine.
It clogs up the toilets. So keep a plastic packet with you in your school bag or in your handbag. Put it in there. When you get home, throw it away. Okay.
Okay, so quickly, people, I'm sorry to interrupt. You mentioned the cup.
The cup.
What
is the cup?
What is the cup?
What is the cup? Okay, so the cup is new technology for women when they're having their periods. And it's almost like a funnel. So it's got a bowl shaped with a little spout at the end. And you put it into the vagina. So during the day it collects the menstrual blood. But it's something that you can basically take to the basin, wash out, and put back in. So it's great if you don't want to be spending a lot of money on tampon and pads. And also you're not throwing it away. So it's quite environmentally friendly.
Wow, we are learning. We did say we're going to learn today. I'm learning a lot.
New thing. And as we talk about it, aren't you becoming more relaxed? Yeah, I'm becoming relaxed. So just take deep breath.
Just take it all.
Deep breath.
So you were saying from the bottom up.
From the bottom up. Okay, so going a little bit further up. Wait, one more thing, guys. Do not either don't wash with soap. Perfumed deodorants. No, not a good idea, because like I said, it's like a swimming pool. You know, you don't want to be adding things.
Okay, cool. So what should one do when they want to sort of clean their...
Okay, so either you do not wash with soap at all. Only with water. You know, and thoroughly give it a scrub. Okay, or if you have to use soap, because the rest of you need soap, plain white soap.
Okay, cool.
No funny business.
No funny
Okay.
business.
No funny
manga
business.
manga.
No perfume, no little essence of tea tree oil, nothing.
This whole idea that, you know, we smell funny down there, and that's why you need to start using all of these special that smell like roses thing. This is in your head.
Patriarchal construct.
Yeah, you don't smell funny.
Patriarchy, boo.
And
Sorry.
Yeah, and if you do smell funny, that means that you might have an infection.
Go to the doctor.
Go to the doctor.
Okay.
So
that.
moving
So
up.
wriggling up, yeah.
Right, wriggling up. Okay, so as you're growing older, your breasts are starting to bud.
Okay.
So you need to start performing self-breast exams.
Okay.
Right when you're early, because the breasts are filled with all sorts of lumpy things. You have mammary ducts in there, and you have fatty tissues, and everybody's breasts are different. Different shapes, different sizes, different textures. Get familiar with your own breasts and how they feel like.
Okay.
Okay. So what else can we tell you about?
Self-examination.
Self-examinations, yes. You put your hand over your head
Okay.
and you start moving around in the clockwise direction.
Hang on, I'm
Clockwise.
catching up.
Okay. Okay.
Okay, like this.
Yes. So
Okay.
as you will start feeling lumps and bumps.
Okay.
Get familiar with your normal lumps and bumps.
Okay.
Because if there is an abnormal lump or bump, you will know about it.
Okay.
And by the time you hit 19, you want to go make friends with a gynecologist and start getting regular pap smears.
Okay.
Wow.
Okay.
So that's how early cancer starts creeping in.
If you are sexually active, then you should start seeing a gynecologist as you become sexually active.
Yeah, just to make sure things are.
Yes.
Everything is
down.
in balance. The pH
Okay.
is right.
So we've covered biological. So what about the psychological implications of sexual health?
Of sexual health. Well, a very important thing that affects girls, or boys too, is our body image.
Okay.
So what is very sexy is confidence.
Okay.
We need to get in touch with who we are as people, our self-worth.
Okay.
Because if we don't have self-worth, then we put ourselves in sexually risky situations.
Okay.
We are acting from a place of insecurity and fear, and we might choose to be sexual with somebody because it validates us instead of because we want to be there. So
Okay.
work on your confidence.
Okay.
Okay.
All right.
The other thing is you need to know the difference between love and lust.
Okay.
Definitely.
Yes.
Yeah.
Yeah, we get into relationships because we want the friendship, the companionship, the romance, all of those things. But when you're a teenager, your system fills with all of these hormones and you feel aroused.
Okay.
Now, you need to know the difference between arousal and between love.
Okay.
And if you're going to get into a sexual situation, whatever that situation might be, do it for the right reasons.
Yeah.
Okay. So so you're just saying, you know, bear in mind what's going on in your mind and in your body, and take a step back and just think about that.
Absolutely.
Think
If you're
about
going to
that.
follow your heart,
Yeah.
take your head with you.
Okay. Okay. All right. That's something to remember. And then, so now we've covered the individual. Now let's cover the community. How does socially, what are the implications of sexual health?
Okay. Well, I think for all of us, it's different because we're all coming from different cultures, we're all coming from different religions.
Yeah.
And something that really impacts on us when we're growing up is how positive and open the community we're in is towards sex, or how hostile it is towards sex. But something that really gives us a message is the media that we're listening to or watching.
Okay.
So look at the messages. Like if you're watching whatever your favorite TV show is, like right now you're watching a TV show, we're trying to be positive about sexuality. But you might now go listen to a song or watch a film which is saying, well, women need to be in domesticated roles or men need to be really, really macho. Do you agree with those things,
Okay.
those messages?
Okay.
So question.
Yeah. Question what you're
Question,
looking at.
question,
Think
question.
critically.
Think critically.
Okay. And is it ever too early to lose one's virginity? Is there like a checklist?
Yes,
know?
there is actually a
Okay.
checklist.
Okay.
There absolutely is a checklist. Like we were saying, sexuality is global.
Okay.
You need to be ready physically, you need to be ready psychologically, and you need to be ready socially. So
Okay.
there is a checklist.
Okay.
So you can even think of socially as, can I talk to my parents about the fact that I'm sexually active? Am I legal? Can I
Okay.
go and buy a condom if I need it?
Okay.
Oh, okay.
You know, so there is a checklist. Can I speak to the person that I'm having sex with
Yeah.
about how I feel?
Okay.
So if you're able to tick, like, all those off your checklist, then does it necessarily mean that you're ready?
It might mean that you are ready. There's the readiness tree. It's like, okay, I pick all the I can climb the readiness tree, but it means that you are now able to say yes to sex. Whether you want to say yes with that person is completely up to you.
Okay, all right. Well, thank you so much for all of that.
My
We're
pleasure.
going to be covering a hell of a lot more just shortly after the break.
It's already break
I
time.
know, I really want to keep picking her brain. But we'll be back with more information. Stay right where you are.
Bye, guys.
Welcome back, guys. We're so glad that you've stayed with us, and for those of you who are just joining us, we're talking sexual health this evening with our wonderful guest, Avri Spilker, who is a human sexuality educator. I got it right that time. Woohoo! Yay. So, because there's so much that we want to get through and it's so interesting, let's just dive right in, shall we?
Mm-hmm.
Really?
Without a doubt, yes, of course.
You don't sound excited just looking at me going,
No.
Yes.
No, I'm just waiting for you to introduce it, and
Okay.
we're all amped.
All right, awesome. So this time we're doing it for the guys out there.
And because we're doing it for the guys, last segment we did it for the girls, and I made everybody say vagina. I think we need to make everybody say
a male.
We need a male
biological
perspective
term
on this.
Yes.
Is it?
So
okay, you
one,
reckon? Count of
two, three.
Penis. All right,
That
now we
was
can
fun.
get started.
Yes, we can get started. Okay, so from a biological aspect, from the bottom down, what do guys need to look out for?
Okay, well, during this time, testosterone gets stepped up. There's a lot of growth happening in the body. So, of course, the penis grows, the testicles grow, the voice box changes. There's going to be a lot of fluctuation in the sound and the pitch of the voice, as well as the growth of the Adam's apple. But I think one of the most embarrassing things that happens for guys is that you get erections. And the erections can happen spontaneously at any point without your control.
That's so cute.
There's definitely a surge of testosterone first thing in the morning, so it's very normal and natural to have an erection first thing in the morning.
Okay.
And you also get wet dreams or nocturnal emissions, so you might wake up during the evening covered in ejaculate, and that's also normal. So there's a lot of stuff that might seem very embarrassing when you're a teenager, but it's all normal and natural.
Can take a nice deep breath.
breath. That's fine. Also something, guys, that you have to remember, because even adult men get very uptight about this. Shapes, sizes, circumcised, not circumcised, all normal.
Okay, all right.
Whatever, everybody's different.
It takes all
It takes all types.
to make the world.
Takes all types.
It does, definitely. And then for keeping men, for them keeping sort of clean.
Okay, so different from the girls who have this careful balance and ecosystem, men are not like that.
Soap.
Yes. So for you guys, you need soap and water, and that's all you need. Give it a good wash, whether you have a foreskin or not, and it keeps it all clean.
And don't they have to clean, beneath the foreskin and make sure that's all?
Yes. Just pull back the foreskin.
Nice and
Give it a
balanced.
good clean.
It's very important as well for hygiene purposes, because the least thing you want is, you do know that you are collecting up bacteria and everything, because
There's
with
a term.
weathers such as this, one could be wearing pants, long johns, and you got your jogs and everything, and it can get rather heated perhaps. And so for hygiene purposes, have a shower, proper wash, and make sure one is clean.
Yes,
for
absolutely.
Sure. Definitely.
Yes.
Definitely. And then from a psychological perspective for young guys out there?
I think that there's a lot of pressure on young guys to act in a certain way, to act like the big guy, to
Macho
get the
man.
girl, macho man. And, this can be really damaging for girls, but it's hectically damaging for guys to have to act in that type of way. So my advice for guys is know yourself. Choose a role model that you can look up to and be secure in yourself. Cultivate that sense of security, because that's really going to hold you in good stead.
Yeah.
The other thing that's really important is to learn how to get consent from other people, because that's part of being a responsible sexual being, and that's really part of health. So my 3-step approach to getting consent.
Okay.
Right.
Okay. Yes.
Listening up.
Yes.
Aimed for that as well,
Yes.
please
Yes.
You need a
Okay.
pen.
I lost mine earlier.
Okay. All right,
So
put it in.
Yeah,
Okay, so number one, to get consent, you need information to make a rational decision for yourself. So give the girl the information. I would like to kiss you. Okay. Now she has that information. She can make a decision for herself. Would you mind if I kissed you? Would you like that? Okay, now she's going to give you the yes. Okay, so yes. So you need a verbal yes. Okay. But that verbal yes needs to match the body language yes. Yes, the body needs to say that yes as well. Because if she says, that's not really a yes. That's kind of a no. So a yes looks like this. Yeah, yeah, I would like you to kiss me. That sounds like a fantastic idea. Okay, so it's very important for guys to know themselves, feel comfortable in their masculinity, and to ask for consent when they're relating to other people.
Yeah, of course, yeah. And with those 3 points that you've just pointed out of consent, excuse me, I just feel that it's important that it is drilled in into young gentlemen as they're growing, you know, to avoid all the matters and issues that our country is experiencing at the moment, and not only our country, but, you know, globally, but just to focus where we are at the moment. You know, it's the consent is of core and is of great importance.
Absolutely.
And no coercion either way, because I'm sure there are situations out there where guys are feeling pressure to do things.
Absolutely. Guys, you should be getting your yes as well. You know, when she's coming to you, you deserve that yes. You have to give your yes as well. And she needs to be asking you as well, because there needs to be respect.
And a dialogue going here as well. Okay, so then we've covered the biological, we've covered the psychological, now we've got to talk about the social.
We've got to talk about the social. Okay, exactly the same for the girls. Guys also get all these types of media messages whenever they switch on the TV, listen to the radio, open a magazine. So guys, you got to question that. You really got to get right in there and go, do I really agree with what this guy is saying to me about my own sexuality? Is it healthy for me? I need to think about that. Socially, we get all sorts of stuff from our environment. The other thing is, look at your community. Is it giving you a positive message? Can you talk to your parents? Can you talk to your teachers? So if you can't, try and talk. Open that conversation.
Okay, cool. So then let's jump straight into the health-wise of the matter in terms of keeping yourself protected from infections, diseases, etc., etc.
Okay. If you are sexually active. Okay. So the first thing that you need to do is you need to know what your status is. Okay. So you need to get yourself tested, and you need to get yourself tested for the big 5. It's HIV, it's chlamydia, gonorrhea, syphilis, and herpes. So go to your clinic and get yourself tested for all of those. And please get your partners tested as well.
Go together.
Make it a date. Bring your picnic along.
What are the costs of these things? Because maybe people may be afraid that, you know, it's going to rip me off and I'll be left.
Not going to.
It might not be a rip-off, but they may feel that.
Costs, absolutely.
It's an unnecessary cost, you know, whereas it is of
paramount importance.
It is paramount importance. And at very least, you get your HIV test done. Okay, so the full battery of tests is 750 Rand, which I know can be very expensive for teenagers. But, you know, if you think that you're old enough and ready enough to have sex, then you're old enough and ready enough to take financial responsibility for that. Okay, so just think of it like that. You find the money, and it's everybody's financial responsibility. Okay. The other thing is that if you're a girl, you need to look at the contraceptive options that are available to you. So look at the pill, the injection, the patch. You need to speak to your gynae or the nurse at the clinic about it. Guys, it's half your responsibility financially to pay for it if you have a partner, okay? Because parenthood is a joint thing, two to tango. Okay, you need to use condoms every time, consistently, for all types of sex. So oral sex counts as sex. Vaginal sex counts as sex. And anal sex counts as sex. Because you can get STIs from all of these different types of sex.
Okay, so even from oral sex?
Even from oral sex.
Is like safe?
So,
HIV plays a huge factor in that as well.
All different types of sex, you can get STIs from. So you must use condoms for all different types of sex. And it's also used a water-based lubricant. Because things like Vaseline break the condom.
Okay.
Which means that the STIs can
Vaseline,
pass
when
through.
you touch it, it feels a bit like granularly.
Yes.
I sounded like a hippie there.
Yes.
I could feel like ketone or
Schwa,
something.
it breaks down the condom. Don't do
Bringing
it.
some science into it.
Okay.
Water-based lubricants only.
Okay. All right.
Okay.
And then any other sort of health tips that you can think of on the fly?
Okay, the thing about STIs
Being
is
on
you
the spot.
cannot use visual confirmation.
Okay.
You know, the whole idea if it looks funny and smells funny, don't touch it. This is not a good methodology for diagnosing. You are not a doctor,
Okay.
so don't act like a doctor. The only surefire way
Okay.
to know about STIs is to go to a doctor and get it checked out, because some STIs are completely silent
Okay.
in their symptoms.
I like what you said earlier. It was
chlamydia.
off air though. Assume everyone.
Yes, assume everybody has STIs and act accordingly.
Okay,
Thank you.
cool. All right. Don't get terrified though.
But one
Yeah.
last thing about STIs, the most important thing to remember is that not to stigmatize.
Okay.
Yeah.
Okay.
Okay.
All right. And then let's talk about masturbation for the guys and also for the ladies, because we missed it out
Okay.
in the last segment.
Okay, cool. So masturbation, guys, I'm going to give you the biggest tip of your life here. Exploring your bodies is a natural, important thing to do from when you're very young to when you're very old. Okay, and for girls too, because otherwise you don't know how things work and what feels good for you.
Okay.
Guys, masturbate slowly, because that's a habit that you're going to take into adulthood with you.
Okay.
And if you learn to masturbate quickly as a teenager, which I understand because your parents might walk in on you and because you just want to get to the other side, you learn to ejaculate quickly.
Okay.
And that does not fit with the arousal cycle of your partner.
Okay.
For girls, I think one of the issues that girls have is that they're told that, you know, good girls don't do that.
Okay.
And that when you meet a man, he's going to show you how to pleasure yourself and
Okay.
how you're going to experience pleasure.
Okay.
And that's not true. That's very sexist and patriarchal.
Yeah.
You need to get in there. You need to learn about your body. You need to explore. You
Okay.
need to masturbate.
Okay, cool. Not gonna get like fur on your hands or go blind.
You're not not going to go blind. You're not going to get hairy hands. You're nothing. Then you're not. It's not wrong.
Okay.
It's
Okay,
natural.
cool.
It's good.
All right, thank
I've
you.
got
And
a very
Yeah?
great quote that I'd like to read. I came with our research out and
Yeah.
we came across this. And this quote goes, "Unless I see myself as being successful in the world, I have no reason to take care of my sexual health or that of my partner." Explain that to us.
Yes, that's my quote.
she said that. Yes, that's her sage advice.
Okay, I'm
So
sure
yes,
I
I'd be
saw it
glad to.
somewhere
I'd
with
be
the
glad to explain
research,
that.
yeah,
Okay.
yeah.
It is very important for us right now to see a future for ourselves.
Okay.
You know, ourselves in the future, in jobs, making money, with families, whatever it is that we want to do in the future. In order for us to make a healthy decision for ourselves right now,
Okay.
we need to see that future.
Okay.
To look after my sexual health right now, I need hope for that future. I
Okay.
need skills for that future. I need resources for that future. I need knowledge for that future. So teenagers out there today can't just have condoms handed out to them. They
Okay.
need those condoms with sex education and skills in order to reach the futures that they want.
Okay. All
So that's what that quote means to me.
Okay. All right.
That's an awesome quote.
It's
I must say.
fantastic, actually.
Yeah.
I really like that. Do you want to read that one more time so it goes home?
I will. "Unless I see myself as being successful in the world, I have no reason to take care of my sexual health and that of my partner."
Thank you, Avri
Great quote.
Spilker. That's incredible advice.
My
Thank
pleasure.
you so much.
Thank you so much for having me here.
Yes,
Thank you,
it's
Maria.
been
You've
great. You've been
informed
really
us greatly.
informative.
Informative.
Yes, English is running away. So course, I can't even form sentences right now.
School papa. Yeah, the tongue is just losing its muscle or grip.
Yeah, well, thank you again for joining
Thanks
us.
so much,
and
yeah.
she will
Pleasure.
be with us again tomorrow evening talking about teenage pregnancy. Yeah, fantastic. So please join
Do
us
join.
tomorrow, same time, same place. We'll be talking about teen pregnancy. And thank you for watching this evening, guys. Bye.
Take care.